was growing up, my grandfather really had his heart set on somebody in our family going into healthcare. Kind of landed on me, so just us talking about being a nurse and what that meant and what he wanted. He'd take me around to meet different doctors and stuff like that, and so it just kind of became what I wanted to do. We're here for primary care needs, but we also offer same-day appointments and walk-ins now. So even those that aren't looking to establish here, we're still able to provide care for them when they need it. You know, a lot of times people do have other providers, but when they call and they're sick, they're not able to be seen. So something we pride ourselves on here is to be able to provide those sick visits for people. You establish with a patient and they get things that they didn't really know they needed, as well as the medicine they need to get better for what they actually came to you for. So one great piece about here is that we now have Dr. Holmes, who's been coming up. He comes up every other Wednesday morning. He brings his crew. So any of my patients that don't have a cardiologist or don't want to travel out of town for a cardiologist, I'm able to send referrals to them, and they're able to see my patients here in the clinic. And with gas prices, how they went up, the pandemic, it's kind of nice to be able to have health care here, and not just health care, but high quality health care. I love this community because it's so close-knit and everybody knows everybody. And that's what I like about working here, is I get to take care of people, teachers that I had growing up, nursing instructors, people that I had interactions with at Southern Union, which isn't far from here. It's kind of nice to give back and take care of those that took care of you when you were growing up, that kind of helped you become what you are. My kids go to Hanley here. I have one at the high school and one at the middle school. They've always been active in softball and sports. Been able to cheer them on with that. Kids ride to practices with us, and we'd go eat after to the local restaurants here, the Mexican restaurant, and you know, you can always do great things over chips and salsa and have great conversations. And it's not always that you go to a big city and that's where you get the best care. When you kind of slow down a little bit, you take the time to listen and put together a good treatment plan, then small town medicine actually becomes pretty appealing.